To my dear brothers and sisters, parents and grandparents, teachers and coaches, mentors and guidance counselors, lay and professional mental health counselors all over the world. It's my pleasure to present to you this topic about the pros and cons of cannabis use among youth. Cannabis is a substance that many young and old people have tried or used over the years, with much more widespread use since the legalization of use for medical and recreational purposes, with altering the lives of many young people and their families. For those who are new to my YouTube channel, my name is Dr. Maher Kazman. I'm a board-certified child and adolescent and adult and addiction psychiatrist with over 35 years of clinical practice experience, helping those who are afflicted with mental health and addictive disorders in the state of California in the United States of America. In this video, I will answer the following questions. What is cannabis? How prevalent is cannabis use among youth? What are the pros of cannabis use? What are the cons of cannabis use? How can parents identify if their child or loved one is using cannabis? What are the criteria of cannabis use disorders? How is cannabis use diagnosed? And what are the best treatments available for it? And let's start first with learning about this substance called cannabis or weed. What is it? Cannabis or weed is referred to by different street names, including Mary Jane, bud, grass, trees, ganga, chronic, dope, and hemp. Also, we hear of hashish, which is resin from unpollinated female plants, where hashish oil or cannabis oil can be extracted with using solvents. According to Wikipedia, cannabis is a genus of flowering plants in the family Cannabicaceae that is widely accepted as being indigenous to and originating from the continent of Asia. However, the number of species is disputed, with as many as 3 recognized species, including Cannabis sativa, Cannabis indica, and Cannabis ruderalis. The cannabis plant contains over 140 pharmacologically active cannabinoids, and among them are the phytocannabinoids. Phytocannabinoids are naturally occurring compounds in the cannabis plant, which are distinct from the endocannabinoids which are produced by the human body. And the phytocannabinoids include THC or delta-9 tetrahydrocannabinol, which is the main psychoactive ingredient in the plant that leads to the euphoric effects, but also it can cause psychosis and has anti-inflammatory properties. The percentage of THC in current products is about 15 to 20%, and sometimes up to 35% in some products. Another phytocannabinoid is the CBD or cannabidiol, which is non-intoxicating with potential anti-anxiety and antipsychotic properties. There is also delta-8 or delta-8 tetrahydrocannabinol, which is mildly intoxicating with less anxiogenic effects than delta-9, but overall it's less studied and only found in small quantities. There's also CBG or cannabigerol, which is non-intoxicating, potentially anxiolytic, and also anti-inflammatory, but there's lack of studies on it, with mostly still in the preclinical animals studies phase. You may hear about the entourage effect of cannabis, which suggests that the full spectrum of compounds rather than the individual components like THC or CBD alone contribute to the plant's therapeutic benefits and enhance the effects of all the compounds when used together. The phytocannabinoids interact with the endocannabinoid system in the human body, which is a highly complex endogenous system that includes CB1 receptors that are G protein coupled receptors expressed in the central nervous system and the hippocampus, neocortex, and basal ganglia areas of the brain. And they modulate pain and mediate motivation, mood, and cognition. There are also the CB2 receptors, which are found in the peripheral tissues and also in microglial cells in the brain and spinal cord, and they modulate immune and inflammatory response. And then there is the anandamide, which is a naturally occurring endocannabinoid. And as illustrated in the image to the side of the slide, left side of the slide, THC binds mostly to CB1 receptors, but also it binds to CB2 receptors, while CBD, though it doesn't bind strongly to CB1 or CB2 receptors, like THC, it can indirectly influence their activity by affecting the body's own endocannabinoids. Then there is CBN or cannabinol, which is a phytocannabinoid that is mildly psychoactive with low affinity and partial agonist effect at both CB1 and CB2 receptors. And we should also mention synthetic cannabinoids, which are lab-made substances that are chemically similar to compounds found in the cannabis plant and can produce serious negative health effects. These products, which are also known as spice or K2, may have a much higher concentration of THC and can be much more powerful. And it's been shown that the use of synthetic cannabinoids is associated with potentially life-threatening health effects due to the increased risk of its toxic effects. But how prevalent has cannabis use been or has become? Cannabis is currently the most used illicit drug in the United States, with about 15 to 20% of Americans using it each year, which comes up to 45 to 50 million individuals. Rates of adult use have increased during the COVID-19 pandemic, driven by heavier use by previous users due to isolation, loneliness, and anxiety, depression, and disruptions in daily routines. About 20 to 30% of individuals who use cannabis develop cannabis use disorders, and 30 to 50% of users are daily users. According to the CDC statistics and studies, in 2022, 30.7% of 12th graders who are high school seniors reported using cannabis in the past year, and 6.3% reported daily use in the past 30 days. 6% of 8th grade students and 15% of 10th graders reported past year cannabis vaping, also in 2022. As many know, use is easily concealed because of vape pens, and also it can be in form of edibles and also used in beverages. It has been found that cannabis use disorders has doubled in the past decade. But where does cannabis use stand under federal and state laws in the United States of America? Until now, cannabis plant is a federal Schedule I substance with high potential for abuse and not currently accepted for medical use in the US. The Farm Bill approved by Congress in 2018 provided an exception for hemp that has less than 0.3% of THC, but cannot be used in dietary supplements. And it gave protection for hemp research and rise of CBD products. 39 states allow legal medical use of cannabis, and 24 states legalized cannabis for adult recreational use. In 2018, Epidiolex, which is CBD solution, was approved for treatment of seizures associated with two rare and severe forms of epilepsy, which are Lennox-Gastaut and Dravet. And here we come to the question of what are the pros of using cannabis? As you all know, cannabis consumption can induce euphoric state characterized by feelings of happiness, joy, and elation. And the effect is often associated with the activation of the endocannabinoid system in the brain and release of dopamine. With smoking or vaping, cannabis, the onset of the euphoric effects is within few minutes and may last up to 3 hours. But the onset with edibles is within 30 to 90 minutes and may last up to 24 hours. But there are also medical and therapeutic uses for cannabis, like the use of cannabidiol or Epidiolex for seizures, as we just mentioned. Another product is dronabinol or marinol, which is used for anorexia associated with weight loss in patients with AIDS and nausea and vomiting associated with cancer chemotherapy. Also, another product is Nebilone, used for mixed neuropathic, nociceptive pain or abdominal pain or neuropathic pain and spasticity. Also, another use of cannabis for medical purposes is for glaucoma relief because it lowers pressure within the eyes. And some states have qualified some psychiatric conditions, though there's no evidence-based for that use or these uses, and it's not FDA approved. An example of conditions that states allowed to use medical marijuana for is PTSD, anorexia, autism spectrum disorder, anxiety, depression, panic disorder, obsessive compulsive disorder, bulimia nervosa, and Tourette's syndrome. But if these are the benefits or the pros, what are the cons of cannabis use? And as we see in this image before you in this slide, you can see the negative effects manifesting throughout the life cycle, starting with the fetus. If exposed to his pregnant or her pregnant mothers using it, resulting in decreased gestational age, decreased birth weight and length, decreased head circumference, decreased response to light, increased startle response, and increased tremors. Also, later on, as this child grows, they may as an infant or child, they may manifest decreased memory skills, decreased verbal scores, decreased mental development, decreased attention and concentration, decreased sleep efficiency, increased nocturnal arousals, increased motor skills in form of hyperactivity, increased impulsivity, increased aggression, and increased delinquency. And in adolescents who use cannabis, they may manifest decreased visual perception, decreased visual memory, decreased verbal reasoning, decreased concentration, decreased IQ score, increased impulsivity, increased hyperactivity, and increased delinquency. And young adults who also use cannabis frequently, they may manifest decreased response inhibition, increased risk of psychosis, impaired neuronal functioning with impairing the visual spatial working memory, and manifesting depressive symptoms. And as we dive further into the negative effects of cannabis on the different body organs and systems, looking at the cognitive effects, we see memory problems with decreased ability to form new memories through its effects on the hippocampus mechanism of processing information. Also, they manifest impaired judgment with slowed reaction time, altered balance and coordination, and also altered reflex response or delayed reflex response. Also, those starting use during early adolescence were found to lose an average of 8 IQ points when retested at 38 years of age. And also, we frequently see amotivational syndrome, which includes lack of goal-directed behaviors, also lack of emotions or being emotionally blunted, and decreased interest in doing activities that used to be enjoyable. And it usually results from frequent use of cannabis and occurs in about 16 to 21% of chronic marijuana users. Other cons of cannabis use are developing addiction, and the risk of developing cannabis use disorder among adolescents who begin using cannabis before age 18 is about 4 to 7 times more likely to happen compared to adults. Also, we see mood effects with teens using cannabis recreationally to be 2 to 4 times more likely to develop psychiatric disorders such as depression and suicidality. And in another study, 27% of people seen in the ER for cannabis use developed a new anxiety disorder within 3 years. Also, we see perceptual and psychotic effects with adolescent cannabis use found to be associated with increased risk of psychosis later in life, with about 2.4 times more likelihood to be diagnosed with schizophrenia. And continuing with the cons of cannabis use with its effects on the immune system, as it may suppress the immune system, causing a more vulnerability to infections. On the respiratory system, the mixture of chemicals smoked or vaped can cause irritation to the lungs and bronchial passages and lead to burning throat, phlegmy cough, or increased risk of bronchitis. In pregnant women who use it, it can affect the developing fetus and may result in having memory problems, decreased concentration, and also impairment of problem-solving skills. On the circulation, it causes jump in the heart rate with expansion or dilation of the blood vessels that may result in redness of the eyes. Also, long-term and heavy use may cause severe nausea, vomiting, and abdominal pains, which are called cannabis hyperemesis syndrome, and it may take weeks for these symptoms to resolve with abstinence. So how can parents tell if their child or teen or loved one is using cannabis? They may smell the pungent smell of marijuana in their hair or clothes. Also, they may notice that their eyes are red or bloodshot. The child or teen may have delayed reaction time and also may manifest mood swings that they have not presented with before. Also, they may observe increased laziness or sleepiness, sleeping for many hours. Also, they may find in their room marijuana-related items such as rolling papers, pipes or bowls for smoking, cartridges, vaporizers, or edibles, which we call cannabis paraphernalia. Also, they may have increased anxiety or act in a paranoid manner, thinking that people are talking about them or plotting and conspiring against them. Also, they may manifest increased hunger with eating excessively. This behavior known as the munchies. But how do we diagnose cannabis use disorders? For someone to be diagnosed with cannabis use disorder, one needs to meet the DSM-5 criteria, the Diagnostic Statistical Manual version 5 for mental health disorders, which is in use in the United States of America. And they need to at least have 2 of 11 factors that occur within a 12-month period. First one is taking more cannabis than was intended. Second is difficulty controlling or cutting down cannabis use. Third is craving for cannabis. The fourth is spending a lot of time obtaining, using, or recovering from cannabis. The fifth is having problems at work, school, and home as a result of cannabis use. The sixth is continuing cannabis use despite related social or relationship problems. The seventh is giving up or reducing other activities in favor of cannabis use. The eighth is taking cannabis in high-risk situation. The ninth is continuing to use cannabis despite physical or psychological problems. The 10th is developing tolerance to cannabis. And the 11th is having withdrawals or withdrawal symptoms when discontinuing cannabis. But how do we assess for cannabis use disorder? Of course, if you see any of the warning signs of cannabis use in your child or teen or loved one, or someone that you coach or your mentor or counsel, you need to encourage them to seek professional help from an addiction specialist, but they also can start with seeing their own primary care physician. And when seen by the specialist, the following questions are asked. We ask about the type, which products are being used, route of delivery, strain or product, and THC content, also place and method of access. We ask also about the duration. When did you first start using the product? We ask about the frequency, how often you've used it in the last 2 months. We ask about the peak use, how much were you using it at the peak of use, and we also ask about the purpose. What do you use the cannabis product for? What does it do for you? And one may ask, what is the standard workup or lab tests used to confirm that someone is using cannabis? Urine testing is the first mode of test that we use because cannabinoids can be detected in the urine for as many as 21 days after chronic use and also even up to 4 weeks. But after acute use, usually 1 to 5 days is the normal urine positive period. And the primary method in the urine testing involves enzyme immunoassay or radioimmunoassay. But to confirm the positive results, gas chromatography and mass spectrometry or thin layer chromatography are used. Second way of testing is blood testing, which is used to measure quantitative levels of cannabinoids and to distinguish between recent use and residual excretion. Then the newest modality is saliva testing with newer technology for detection, especially for recent use. Another important question about testing is what brain imaging may show or tell us in evaluating those who use cannabis frequently. And imaging studies, specifically functional MRI and diffusion tensor imaging techniques, showed us significant differences in the magnitude and pattern of signal intensity change within the anterior cingulate and dorsolateral prefrontal cortex of the brain while performing standardized tasks in chronic marijuana smokers compared with healthy controls. And that is in a study by Lawrence and Jennen in January 2024. And as we see in the images in the left lower corner, how a healthy brain looks compared to a brain damaged by marijuana use. And in the middle bottom part, we see a comparison between a normal brain and also a damaged brain of a 16-year-old with 2-year history of daily abuse, and then a brain of an 18-year-old with more progressive damage after a 3-year history of 4 times a week use of cannabis. And the damage is probably explained by THC blocking of synaptic plasticity and neurogenesis. With the younger the user, the longer brain development is arrested and the more permanent the damage is. Additionally, with marijuana use in adolescence, there's an increased risk for developing psychosis and clinical depression that can persist into adulthood, as we discussed before. And to prevent these long-term and permanent adverse and negative sequelae, early intervention and treatment needs to be provided, starting with outpatient drug counseling in a mental health clinic or addiction treatment center, with also assessing for any comorbid psychiatric disorders that needs to be targeted for treatment. In some cases, there may be a need to start treatment with admission to an addiction treatment center for detox. Also, there may be a need for referral from just outpatient treatment to more intensive treatment like a day treatment program, which is partial hospitalization program, as a step up from outpatient therapy, or step down from detox unit or residential treatment center to provide the support needed to continue sobriety and abstinence. Also, for those who fail outpatient treatment or partial hospitalization treatment, referrals to residential treatment center may be warranted for periods between 30 to 90 days to provide the support and structure and supervision needed to continue sobriety and enforce abstinence, and develop appropriate healthy coping skills to deal with triggers for relapse. The different therapies used in these treatment settings include cognitive behavioral therapy, which is CBT, acceptance and commitment therapy, ACT, dialectical behavioral therapy, DBT, and motivational interviewing. And as you see in the slide on the right side, there is a listing of the different treatment options for drug addiction, including cannabis use disorders, and it includes support groups, medication-assisted treatment, and lifestyle changes, as well as long-term support. And the groups that are provided are usually like AA or NA groups, and these groups are usually led by fellow recovering members and follow the 12-step format of AA and NA. And the 12-step recovery model includes the following steps. Step 1 is admit powerlessness over addiction. Step 2 is believe in a higher power. Step 3 is turn life over to a higher power. Step 4 is conduct a moral inventory. Step 5 is admit wrongs. Step 6 is to be ready for character defect removal. Step 7 is to ask for removal of shortcomings. Step 8 is to list harmed individuals in preparation to make amends and restitution. Step 9 is to make direct amends. Step 10 is to continue personal inventory. Step 11 is to seek spiritual connection. Step 12 is to carry the message. But it's important really that the person realize that they have a problem and they admit their powerlessness over addiction to begin the treatment process. And as you notice in the 12 steps, there is a place for those with spiritual or faith-based values to tap into the spiritual side of their being and draw support from spiritual connection to a higher power. And that definitely will depend on their own belief and faith convictions. And as mentioned briefly in the previous slide, there may be some who are curious to know if there are medications proven to be effective to assist in treatment of cannabis use disorders. But currently there are no FDA-approved medications. But some supplements or medications have been studied in a limited manner, including N-acetylcysteine, which is an antioxidant and glutamate modulator, with using it in doses of 1200 milligram BID in combination with contingency management showed in one study 2.4 times increased likelihood of THC negative urine tests. Another study looked at gabapentin, which is a GABA modulator, at doses of 1200 milligram a day for 12 weeks, found it to lead to reduced use of cannabis as well as reduced withdrawal symptoms. There is also another study on use of nabiximols, which is CBD spray, that showed reduced cravings but no difference in abstinence or withdrawals. And another one by Freeman in 2020 looked at cannabidiol, which is CBD, doses of 400 and 800 milligrams a day led to reduced cannabis use and more days a week of abstinence over 4 weeks. Other medications to stop smoking weed that have been explored but needs further randomized controlled blind studies include use of nicotine replacement therapy like nicotine patches, gum, or lozenges that's been tried and found to be helpful to reduce withdrawal symptoms and cravings associated with quitting weed. Also bupropion, which is Wellbutrin, a prescription medication commonly used to treat depression and also smoking cessation, has been tried to reduce marijuana cravings and withdrawal symptoms. Also varenicline or Chantix is another prescription medication that's used for smoking cessation, have been tried to help people quit smoking weed by reducing the rewarding effects of THC. Also clonidine, which is originally used to treat high blood pressure, has been prescribed off-label to manage withdrawal symptoms when quitting marijuana. Naltrexone is another medication that blocks the effects of opioid and may be helpful for individuals who use marijuana heavily or experience strong cravings. Then antidepressants, especially selective serotonin reuptake inhibitors like Prozac or Zoloft, have shown promise in helping people quit smoking weed by reducing anxiety and depression symptoms associated with withdrawals. And in this slide is a list of references that have been used to put together the content of this presentation for you. I would like specifically to point to the references from lectures presented at the 34th AAAP annual meeting and scientific symposium that was in December 2023. There were two lectures. One is Cannabis Overview and Diagnosis of Cannabis Use Disorder by Arthur Williams, and the other one is Pharmacotherapy for Cannabis Use Disorder by Kevin Hell, in addition to the other references listed. In conclusion, I want to thank everyone who has watched and listened to this video, and ask if you have found it helpful to press the like tab, and also to share the video with others. And I also encourage you to subscribe for free to our YouTube channel, Know and Grow with Dr. K, through the link shown at the bottom of this slide. And if you have any questions or comments, please contact us at ped.psych101@gmail.com. Until we meet in another video, my best wishes and prayers to you and your families for a healthy, prosperous, and fulfilled lives that are free of any addictions or diseases.